Well, personally, I think one of my motivators was that I had cancer 3 times in 5 years. And so by the third time, I was like, I've got to do something differently because this is not working. But certainly, getting, and I'm fine. I'm 5 years cancer free.
Nice.
So, going through those different cancers, I got to experience the US healthcare system a lot. And, you know, in the US, this is like one of the only high income countries that doesn't provide universal or some sort of supported healthcare for everyone in the country. And so, in general, the US healthcare system has a lot of ways that it can improve. But then also, as an African American, what we saw is that there's lots of ways that our outcomes are worse, that, there's the whole history of segregation and racism in the healthcare system in this country. And so Elaine and I thought, well, and this goes to your question about why body wealth, right? Because a lot of people talk about, generational wealth and building generational wealth in the African American community. But financial wealth doesn't do you any good if you don't have your health.
Hey, Igniters, it's Heike, and welcome to the show. Today, I am on fire. I want to start off this episode by reading a short segment out of the article Racial Disparities in Women's Health by the Network of Public Health Law. Current trends show the lasting and dreadful effects racism has on the lives of Black women. They are 3 to 4 times more likely to die in pregnancy and 5 times more likely to die from pregnancy-related cardiomyopathy and blood pressure disorders than white women. Black women reach menopause 8.5 months earlier than white women and experience worse symptoms. Black women die from breast cancer at the 40% higher rate than white women. Has it occurred to you that healthcare is not the same for everyone? I mean, the care you get, the choices you have, and whether you or not you're judged and treated by your skin color. This time we're diving into healthcare advocacy for Black and African American women in the United States. And who better to guide us than the incredible sisters Elaine Curry and Brenda Barbour? You might know them from the Body Wealth Sister podcast, where they use their love for storytelling to empower and educate our community, especially Black women navigating the healthcare maze. Elaine and Brenda have been there, facing medical challenges that taught them the ins and outs of the healthcare system's complexity. They're joining us to share these hard-earned insights and shine a light on how to advocate for healthcare you deserve as a Black or African American woman. We're talking real talk, asking tough questions, exploring all treatment options, and how to find a doctor who truly understands your needs. It's all about empowering you to stand strong in your health journey. So if you're ready to transform how you approach your healthcare, this episode is your must listen. So if you're ready to transform how you approach your healthcare, this episode is your must listen, ladies. Elaine and Brenda are about to drop some profound knowledge wrapped up in the kind of fun, urgent conversation that makes you want to take action immediately. Let's dive into our feature content. Well, hi, everybody. I'm super excited to welcome Elaine Curry and Brenda Barbour, the sisters of the Body Wealth podcast, on the show today. And we have a huge and super important topic that we're sharing with you guys today. And it's about advocacy for better healthcare for Black and African American women. Welcome to the show, ladies.
Thank
Thank you so
you.
much.
Glad to be here.
Awesome. So, what do you do when you're not behind the mic, Brenda?
Well, what I used to do is manage a communications and knowledge management team for a large international organization. But I am now retired from that gig. And so I do the Body Wealth podcast. That's my full-time gig.
Hey, that's not a bad change, is it?
No, it's great. I get to work with Elaine.
Elaine, how about you?
Yeah, well, I have sort of a varied career over the years. worked initially in technology, then have got an MBA and did some finance work, and mostly working with small companies as a consultant. And now I continue that a little bit and do serve on some nonprofit boards, just a lot of different things. But and the podcast is the main thing right now. And we're not only behind the mic, I'll say, because we are pretty much doing everything so at this point. So it takes a good bit of time, but as Brenda said, working together has been a goal for us both for a while. So I'm enjoying that.
That is awesome. Well, behind the mic sounds a little bit more glamorous than saying, oh, I got to do the Canva things, I go to the editing, and then I do the social media posts, and then I have to do all the odds and ends. I prepare for my own guests. So behind the mic sounds just a little bit more
Yes, it
glamorous.
does.
No, Elaine, no, let me backtrack before I ask you that question. I want the listeners always to know how if possible, I met my guests before I invited them on the show. And I had heard from one of my clients about your show that she posted the Body Wealth podcast all over her social media and said, you got to listen to this. And they're amazing. They're talking about a really important topic that not that many people talk about or bring to the forefront of our consciousness, that this is a problem, that is the situation that we need to talk more about, which is the advocacy of better healthcare for Black and African American women. And so I asked you to come on the show, and you graciously said yes. So Elaine, why did you start the Body Wealth podcast, and where did the name come from?
Let's see. I'll start with why we started. And it's something, first of all, Brenda and I did have a goal in life to work together. We're sisters, we're just a year apart, and we both had our separate careers and had never had the opportunity to do that. And a few years ago, we started thinking about what it is that we would like to do. And we knew that we wanted to support our community. We knew that we wanted to add value. And we knew that healthcare was a place, even though neither of us have a health background, that some work needed to be done. And because we had individual health stories and we knew a lot of people in our networks that had health stories that we could share with each other to inspire and educate and, give us some ideas about how we can be better for ourselves. So that's sort of the genesis of the podcast.
Okay. So, Elaine, do you want to share one of those health issues? Is that something that you can talk about on the podcast?
Well, we can talk. In the first season, we had 12 episodes, and we covered topics from knee replacement, imposter syndrome, adult diagnosed ADHD. So it goes, I mean, we look at mental health issues, we look at physical health issues, and just wellness in general, and how we can, be the best we can be.
That's what we all do, right? We're trying to be the best we can at any time in our life. Now, when we talk about those topics, Brenda, did something happen to you that you can share on the show that you said, okay, this is really important, that contributes to the Body Wealth podcast?
Well, personally, I think one of my motivators was that I had cancer 3 times in 5 years. And so by the third time, I was like, I've got to do something differently because this is not working. But certainly, and I'm fine. I'm 5 years cancer free.
Nice.
So, going through those different cancers, I got to experience the US healthcare system a lot. And, in the US, this is like one of the only high income countries that doesn't provide universal or some sort of supported healthcare for everyone in the country. And so, in general, the US healthcare system has a lot of ways that it can improve. But then also, as an African American, what we saw is that there's lots of ways that our outcomes are worse, that, there's the whole history of segregation and racism in the healthcare system in this country. And so Elaine and I thought, well, and this goes to your question about why body wealth, right? Because a lot of people talk about generational wealth and building generational wealth in the African American community. But financial wealth doesn't do you any good if you don't have your health. And so what the wealth that we really care about is having the resources to have a healthy body and mind. So Elaine came up with the name, and I really love it. And our father just had his 88th birthday, and someone said he's looking really body wealthy. And I thought, well,
We
that's
love
great.
that, right?
This is I think too, it's a great name. And when you explained it, I was like, yeah, this makes so much sense. We have all this wealth, but nobody thinks about the body wealth of our health that we have, and how much we can should appreciate what we have. But sometimes it's hard to get to be the healthiest we can be because of the barriers that are put before us. And especially when we're talking, our topic today is African American or Black women, specifically women. So Elaine, what are some of the common barriers that African American and Black women experience when it comes to accessing quality health care? Just
That
getting
is a
to
great question. Yeah,
getting
and
to it.
we've learned a lot. Even, we knew our own personal stories, but talking to all these women, we've learned so much in doing research. As Brenda mentioned, the historical factors that are in our country that we don't even recognize how they play into what's going on in our healthcare system right now. I mean, for the women that we've talked to, primarily, it's just being listened to. I mean, a lot of times when they get in the healthcare system, people don't hear them. And we've heard so many stories of prominent Black women who have had issues mostly around childbirth right now. We've heard Beyonce tell a story. We've heard Serena Williams tell a story about, how they had major health issues when they were trying to deliver their children, and, it caused problems for them. And they're not alone. Unfortunately, the more people that we talk to, we hear that historically it was taught to medical students that Black people have a higher tolerance of pain. So they were not always given the pain medicine that they needed. And that continues, that they have thicker skin. And so, certain treatments are not given to them that they're needed. And these things still exist today. It's amazing to me. And so we have to, first of all, educate ourselves and hopefully educate the people who are providing care so that, we can get to the best care for all of us.
Brenda, what's your thought?
Well, I think the key is and because we know doctors are busy, insurance doesn't pay them what they need to spend lots of time with you. So there's lots of incentives that keep them from being able to, for example, answer all your questions or spend the time that you need. But what we want to do is really help people given that situation. So what can you do to get the best care that you can? Number one, make sure that you build a relationship with your care providers so they see you as a person, not just as a patient. Two, connect the dots for all your doctors. Oftentimes, especially if you have a chronic condition, you're seeing 4, 5, 6 different kinds of doctors, and they don't have the time to keep up with what medicines, what treatments, what things are going on with you with all those other doctors. So unfortunately, that becomes your job, and you need to make sure to connect the dots so that there's no sort of undesired outcomes because people don't know what other doctors are doing with you. Those are a couple of examples. And, the biggest thing for me is ask questions. Why do you recommend this treatment? Why not this? If this was your brother, what would you do? What else could be causing this symptom? What other treatments can we consider? So just culturally, I think sometimes we've been taught not to question the doctor. They're the one that went to medical school. And so, we just have to do what we're told. And so the more we can encourage people to ask questions, be bold, do your own research, that's the way that you're going to get the best care.
Yeah. Elaine,
And
do you
bring
think
someone
that
with you. That's the other thing, bring a support person, your husband, your sister, your someone else, because you can't always listen and hear everything the doctor's saying if you're in a a stressful situation or a severe health crisis. And just having a second set of ears is very helpful. And
Can
that's
I add
something.
something to that?
Yeah, of course you can.
So when I had breast cancer, I brought Elaine with me to my first meeting with the surgeon. And you're hearing all this information. I wasn't writing anything down. I don't know why. And then I
You
had a
think,
surgery, then I had another surgery, and then something happened. And the doctor said, well, I told you before that that might happen. And I was like, no, absolutely not. She never said that. And I was so insistent, just because of the emotions of, going through treatment. And Elaine said, well, actually, in that first meeting, she did say that. So I'm glad that she was there. Maybe I should have been taking notes. Maybe that's another thing, make sure that you take notes. But it's nice to have someone supportive with you.
Yeah, when you're in a situation like you were, Elaine, with the cancer, I mean, who the heck thinks about taking notes?
right.
You're fighting for your life. You're fighting for your health.
And you're scared.
You're scared. Very true. And you know what? Whatever. And sometimes I always say, that's a misnomer, but I always say, ask what the big words mean. The doctors, they throw all this stuff out and you have no clue. And we're sitting there, like you just said a minute ago, like, yes, doctor. Uh-huh. You're the big man or the woman. You got the MD and you're the whatever you have. And then you sit there and you're so scared that you really don't know what they're talking about because they use all their Latin names and their descriptions and asking for what the heck does it actually mean does not occur to many of us.
Then we go to Dr. Google, and that's helpful in some ways, but not so much helpful in other ways, I know. So
I know.
Well, it
Do you
can't be
think
the
that
only answer, but doing that research, even if it's through books or Google beforehand, I think can make you better understand what the doctor's saying when you get there. So
very true, because then you have a little bit of information of what it is that you are diagnosed with and what you have read. And although sometimes the doctors get a little hostile when you pull out your Google knowledge and you say, so what about this and what about that? And they're like, so how does she know all this? I'm like, well, explain it to me, because
right.
I found
Just
these
knowing the
words.
right questions to ask is key.
Yep,
So.
absolutely. So what are some of the stereotypes and myths, Brenda, that come with health for Black and African American women? What are some of the stereotypes? We talked a little bit about the thicker skin, but I really want to get into the meat of this. So this is not a hold back series where we're being polite and we're putting up a nice little thing. It's like, I want to get into deep and dirty. I want to lay it out so any woman that's listening to this is like, yeah, I can relate to this. This is exactly what I was asking myself. So what would you say about the stereotypes and what are the myth and the stereotypes when it comes to the health care for women?
Well, one of the stereotypes that even I was surprised by is the idea that there's lots of data about worse health outcomes for African Americans, diabetes, many different cancers, childbirth. And so one of the stereotypes is that the reason that we have worse health outcomes is socioeconomic, right? So they're like, well, African Americans do have a higher rate of being uninsured, so it's just socioeconomic. Well, actually, it's not. So there have been studies that Black women with higher education, with advanced degrees beyond college, have worse health outcomes than others. So it's not socioeconomic. There's something else happening in the system that is not about how much money do you have, or whether or not you're insured. So that's the first stereotype that we want to bust, that this is not about socioeconomics. This is an issue in the system. I think one of the examples, and this may be, there was a book that Elaine and I just went to a book talk by Uche Blackstock, and her book is a memoir, because she's a emergency room physician, but it's a memoir called Legacy, about the legacy of race bias in the healthcare system.
Mm-hmm.
And one of the things that she talked about is that during slavery and post-slavery, they did a lot of research on African Americans to come up with a lot of care and treatment. And one of the things they decided was that African Americans had a different lung capacity than European Americans. And so they were creating, Elaine, maybe help explain this for me, because I know you
help
just
out. Elaine, jump in whenever you can help out Brenda. Just help out. It's like,
So
this is collaboration.
Right. They evaluate lung capacity. And of course, if it's decreased, then you get certain treatment. But because they assumed that African Americans had a different capacity, we weren't getting treatment as early. They're saying, well, that's normal for you to have this decreased amount. So that really came out during COVID, that these measurements were still the standards that they were using. And so COVID, of course, affected your lungs. And so a lot of Black people were not getting treated as early because they were using these measurements saying that this is normal for you when it wasn't.
Can I give another example? Because this is kind of the flip, but I think it's interesting. So, a lot of people say, well, race is a construct. So why do you think there's anything different related to race? And certainly with the issue with the lungs, that's true. We are all human beings. So let's do research. But the problem is a lot of the medical research that has been done and has been done in the past didn't include a lot of Black participants. And women used to also suffer from this, where the standard was white men. There are white men in the study. So this is the normal range for white men. And so one of the reflections of that is, different populations, not just African Americans, lots of different populations of people are subject to different diseases at different rates. But so my son, when he was very young, 2 or 3 years old, had a low white blood cell count. I live in Chevy Chase, DC. Of course, I went to the best pediatricians here in Chevy Chase, and they're like, oh, this is really concerning. Lots of tests, follow-up tests, ended up at Children's Hospital. We're in the oncology ward, wondering whether or not he has some sort of blood cancer. And it wasn't until we got to an African-American doctor who said, many African-American men have low white blood cell counts compared to what we think is the normal range. But when they get sick, their white blood cell count goes up to what is needed to fight infection. And I said, oh, I hadn't ever heard of that. He said, yeah, this range of what's a normal white blood cell count was based on data, which was mostly testing white males. So then I went to my father and I said, oh, Evan has this low white blood cell count. And my father said, oh, yeah, I do too. And then I talked to another Black man and he said, oh, yeah, I'm always beneath the range too. But my pediatrician in Chevy Chase didn't know that. But the range that is published for what is a normal white blood cell count, a lot of African-American men fall beneath that, but they're healthy. They're perfectly healthy. So we had this very scary period with my son. He's fine. He's 26 years old. He's perfectly healthy. But every time he gets a physical, it's flagged that his white blood cell count is low.
What I find so interesting about the story is that now we're in 2024. And when you look at what the story you just told, I feel like I'm in the 1800s. I'm like, seriously? You guys, have you learned nothing? Have you not progressed into more inclusion of all races and of all ethnicities, where you say, okay, let's establish a range of blood cell counts for African American men? What is it? Where's our starting point? Where's our new starting point? Or like you said, for women, well, I'm not a 50-year-old male. So why do you measure me according to that? And how do I hold up my standards for that? And that just baffles me why that still is.
Well, the typical symptoms for a woman having a heart attack are different from those for a man having a heart attack. And so once they just discovered that, then women were better able to say, oh, this might be a heart attack. Because if they say, this is what having a heart attack feels like based on their studies of men, then you're not going to have that data. And to be fair, I know a lot of medical researchers who are trying to get more African Americans in their studies now. So that's great, but it's going to take some time. And the other thing is, because of the history in this country, there are a lot of African Americans who don't really have a lot of trust and don't want to participate in medical studies. Very famously, the Tuskegee study of untreated syphilis in African American men, which went on until the 1970s. So it wasn't the 1800s. So I think there are a lot of people who want to do more research so that we can have better data, but you got to get the community to want to participate.
Yeah. What do you think, Elaine?
And that's part of our podcast and what we want to do. We want to put this information out there so people will realize that we need more studies. People will be willing to participate in the studies, and people will fund these studies. And everybody, there's so many factors that are on a spectrum. Everything is not related to your race, but some things are. Everything is not related to the color of your eyes, but some things are. And so we need just a broader spectrum of the way we look at things in general.
Mm-hmm. So can you think of, Elaine, or do you know from the interviews with other your guests on your show, can you think of or tell us about some of the critical learnings about healthcare that have African American women experienced going through their different situations?
Let's see.
Maybe
Brenda, does something come to the
Brenda.
top of your head?
Well,
So
one of the things that I wanted to mention was, because with certain cancers we have a higher death rate even for treatable cancers, that I think one of the lessons for me is screening. Get your screening early. And my colon cancer came early in my life. I was in my 40s, and it was before they at that time were testing for colon cancer. They said you don't need to get a colonoscopy until you're 50. And so I'm so happy that, our mother was really big on, pushing for things, because my doctor didn't want to give me the order for the colonoscopy. And, I had heard from a friend whose friend died of colon cancer that African Americans got colon cancer earlier. And so I asked my physician for an order, and she said, "Oh, no, you don't have to wait till you're 50. You don't have to get it until you're 50. And I said, "Well, I heard that African Americans get it earlier." And she said, "Oh, if that's true, it's probably socioeconomic." Here we go with socioeconomic again. So here I am, and she's looking at me like, "No, this isn't your issue." So finally, I asked her to humor me and give me the order, and she gave me the order, and I had colon cancer. And so for me, since we know African Americans are dying of treatable cancers at higher rates, then let's make sure we find out early whether or not we have certain cancers. Cancer isn't everything, but I'm just using this as an example.
Absolutely, yeah.
And so screening, even if you have to disagree with your doctor and escalate in order to get the orders, I think is important. And knowing when you should be screened. I mean, that's one of the things Elaine and I care about, is helping people even know what they should be screened for.
Tell us more about it, Elaine.
Well, I think, screenings, well, cancer is one, and we actually have not had a cancer episode on the podcast yet, but, it's coming. It is coming. But so a lot of the medical issues we have, people have found that their diet is a big contributor to the problems that they have. So, and that a lot of doctors are not willing to sort of entertain trying to figure out answers using food rather than medicine. So, that's a universal problem. I know.
Big pharma. Here's big pharma. Give me the pill for $500 that you can't get, or buy like $100 worth of fruits and vegetables.
Right. So many people, have had to spend a lot of time. We've talked to someone with IBS. We've talked to people with other issues, trying to figure out on their own what it is that they could do without taking medicine to be healthy. And usually it works better. And in many cases, it's worked better for them than taking medicine, being able to find the right diet that would support their health. and you don't have the expensive medicine. You don't have all the side effects that a lot of these medicines bring with you. And, it seems like doctors are receptive to it after you tell them, but wonder why sometimes it isn't the other way around.
You mentioned that earlier with the socioeconomic situation and Serena Williams, because I read her story about childbirth and the difficulties she had and what happened. She has plenty of money to buy fruits and vegetables. She has all the whatever you need in the world. So there can't be a direct, I'm just, devil's advocate. There can't be a direct correlation between all of those. It's not like 90% of people in the United States cannot afford the food. Let's talk Black families.
I think her problem was related to not being listened to. She was in there telling doctors that she was having something was going on with her after she delivered, I believe. And they would not listen. They were just like, oh, you'll be fine. Just, this is it. It hurts to have a baby, or, something like that. When she was having a serious, I believe, and I don't quote, I'm not sure exactly what the issue was. It was maybe a blood clot or something, that if she had not she had to demand that they actually look at this issue she was having, and had it not been attended to after her demand, she could have actually not survived.
Yeah.
So the fact that she had to go through that, and this is something that we hear a lot now. We've seen documentaries about Black mothers dying after giving birth because nobody believes them when they say, and a lot of times you don't know what's wrong, but when something's wrong with you.
Yeah.
And childbirth is a major physical undertaking, and doctors know this. So I don't, listen to someone when they say something's wrong. Seems easy, but it's been a major problem.
Yep. Yeah. So, what are some effective, from your point of view, and again, from what you learned from your listeners, effective self-advocacy strategies that have empowered Black and African American women to navigate the healthcare system more successfully? Like you said, asking more questions.
With childbirth, I'll just say that having a doula seems to have been something that's been really successful for Black women, because that is a person who is dedicated to the health of the mother. I mean, doctors' main goal is to get the baby out, and that's what everybody wants, a healthy baby, but they're not focused on the mother and what the mother needs. And we know the mother has to be good for the baby to be good. So doulas, and there's a growing network of them, especially in the Black community, that seem to be really helping in this issue. Unfortunately, of course, they're not covered by insurance generally, and it's expensive. But so we need to find a way to incorporate this into our regular, obstetrics practices, I believe. Brenda, you got another?
That's the one I was going to say.
Oh, sorry. That's why I jumped in really fast.
Because we touched on it a little bit throughout our conversation, where we said, bring somebody, ask more questions, educate yourself before you go, or once you know what the issue is, that you can ask intelligent questions that pertain to what you want to know, and especially
and someone we talked to recently brought another one, which is a good one, is, feel free to change doctors. If you're not comfortable with a doctor and you don't feel like they're listening to you or providing you with the care that you feel you need, and sometimes we're afraid to do that, but it's perfectly within our right. And I think that's something that we need to use as a tool as well. Every doctor is not for every person. Their personalities, don't match. So spend time, actually getting to the provider that you feel comfortable with, and we'll work with you to help you solve whatever your issue is.
That's a good one too, because a lot of people or women are afraid to speak up, as we said earlier. It's like, here's the man or the woman, doesn't matter, in the white coat, and we can't possibly speak up. We cannot contradict them, and by gosh, we can't leave them.
Right.
Yes, we can.
You are divorced. I want another one.
That's right.
You're fired.
And
So
really, we are employing them basically, even though there are and so that we should look at it like that.
we're paying for our health care.
Yeah.
You know, most of us can pay for health care. And then the other thing that I would say is go to the doctor. I
Yeah.
hear so many women, my mom included, who just says, I'll be fine. She's 81. I'll be fine. And I'm like, Mom, have you gone to the doctor? Oh, you know, once I get the eye drops, I'm sure my migraines will go away. I'm like, should I just strangle you now or later? And she's just not going. And then she finally went, and they found all kinds of things that she needs to check up on and take care of her health. And she said, I should have never gone to the doctor. It's like,
Right. We had a guest who said that, who said, I didn't want to go to the doctor because I didn't want any bad news. And we were like, the bad news is in your body, whether you want to hear it or not. So better to know so you can address it than not know. So yes, go to the doctor.
or God forbid, die of it.
Yes.
You know,
Right.
it's like we talk cancer. If you have a brain tumor, it's not going to go away on its own. And if you don't know it, you have all these issues with eyesight, with speech,
Yeah.
and God knows other
You
things.
have to be intentional, but because I completely understand. When I used to go to the doctor when I was younger, I would go have my annual checkup and be fine. And they said, see you next year. And then as I got 40 and 50, every time I went, it was like, oh, you need to go see this specialist. You need to go. And it was just not, it wasn't fun. It was,
It takes a
and
lot of
so
time too. I know.
I know that we need to do it, but I understand the hesitation, but we just got to make sure that we keep pushing because that's how we're going to stay healthy as long as we
It's
can.
preventative care. And I was saying this today to my client. I said, in the 1800s, we both were dead already. I'm 62. I would have not made it. And now we're getting more of those things, like whatever things we're getting, right?
Right.
And we're like, oh, now I have to go to the doctor again. But it's preventative care because we want to live longer, stronger, and healthier and not age and be all crippled and can't move and have
Right.
assisted living and other situations that could be prolonged or prevented just by us being proactive
Yeah.
towards our health. And I'm sure it's not any different in the African American community.
No, it's the same. We want to live long and we want to live long well. And so we have to be proactive in order to give
And
ourselves the
even
highest chance of having that.
and even
Mhm.
when we don't feel supported in the system, we still have to push through. And that's part of why, we're talking to these women because we know a lot of people are working on trying to fix the systemic issues in our healthcare issue, but I mean, in our healthcare system. But we're here today and we want to keep living today. So we need to find a way to support ourselves and our goal in that. And so we need to talk to each other. Everything that we learned, we need to share with each other so that we can, be healthy today and hope that they fix it and do whatever we can to help fix the system. But we want to be healthy now.
But I also feel, and I've always kept saying this since I started Pursue Your Spark podcast, that the community around us that we build, like we do with your podcast, the Body Wealth podcast, is a community where we share information. And so when one more person listens to a podcast that may be about lymphatic drainage and she doesn't have anybody, she's like, oh wow, I heard on the podcast they were talking about this. And so the information gets spread among us women because it seems like women speak a lot more amongst each other than men do and share information.
Yes.
And so you have a hub, like in my studio, my brick and mortar studio. I feel like I'm the hub of healthcare. Yes, I teach Pilates, fitness, and nutrition, and I do a lot of orthopedic related Pilates and strength and flexibility work. But boy, do I know a lot of stuff. I was like, people say, you're like a physical therapist. I'm like, no, I don't have a degree. I'm not a doctor,
But
but I listen. And when somebody says, oh, I have this, I said, guess what? Client so-so told me about this and they went to this doctor or they explored that so that we as a community share these vital points, even though we can't change the system as fast as we like, changes are slow, but we can amongst ourselves share that nugget of wisdom that will help so many. What do you
Right.
what do you say to that?
I 100% agree. I mean, we believe in the power of community knowledge. We want to build and share that knowledge for our all, so we can all be as healthy as we can be. We just had a recording this week with the guest who was talking about Pilates and how important it is to her. So I'm like, I need to get to your studio so I can
You're
try
not far from me.
but yes, the idea of talking to each other. We had one guest who has two sons on the autism spectrum, and she talked about how initially she sort of didn't want to talk about the diagnosis, but what she found was the more she talked about it, the more she found other parents who knew someone or knew of some state service or knew something. And so the more she talked about it, the more she realized she could have a community that supported her in getting the best care for her sons. And so I'm just such a believer in building and sharing community knowledge.
Yeah. Yeah. Elaine, what do you think healthcare professionals, from their point of view, have to do to rebuild trust with the African American community? From their point of view, not just where we go educate ourselves, we do all the things we talked about, but what would you say about that?
Yeah, well, listening is easy, and that's the first thing they should do, but they should also recognize their own biases. And I think some of these biases are taught in medical school still. And that, that's something that Uche brought out in the book Legacy, that they're still being taught things, and this goes for Black and white doctors, that sort of continue to promote these stereotypes about healthcare and about Black people within it that are wrong. So we need to fix that. They need to listen, and they need to educate themselves when we have like the information about Black people, about different ranges for white blood cell counts, or they need to educate themselves to be able to service all the patients that might be in front of them at one point.
Yeah. Elaine, Brenda?
No, I think that's great. I think that it's not easy work to really explore your own biases, but we all have biases, and many of them are unconscious, right? And so I think more medical schools are introducing programs to help aspiring doctors figure out their biases, figure out how they can be of service to the entire community. And I think that that's important work, not necessarily comfortable or easy work, but I think it's important for everybody's well-being.
I like that a lot. I was like, because we all have biases. Because when we read literature and the books that come out and overcome your biases or whatever the titles are, I think they don't go deep enough. They don't. It's the everyday biases that pop into your head. Oh, if you see a bum on the street, oh, you automatically assume they are lazy because they are panhandling, or whatever these thoughts are, or what our parents have taught us about certain ethnicities or situations that we come across, that you now catch yourself quicker, I think, or hopefully somebody points it out and says, hey, do you know you can't say that anymore? And you're like, why not? Because you've been brought up with that. And it was never wrong. And and that's something that's, I think, the conscious awakening is so necessary for a lot of those things to change in our different communities. And the more we push for it, the more we don't give in, and the more we speak openly about it without shame, without guilt, without the fear of repercussions. Sometimes I think it is a very empowering way of doing what's right doing what's necessary to be done.
And without blame,
Right.
because that is, we come from where we come from. And we all we learn the bad stuff and we have to learn, unlearn it. It's a process.
And that's why we really appreciate you having us on the podcast, because a lot of people, when they heard, oh, you're doing a podcast about Black women's health. Well, how is Black women's health any different than anybody else's health? And on some level, it's not. But the thing is that all these differences that we've just talked about do exist. And to be able to have the conversations, even if they're uncomfortable conversations, is the only way things are going to change. And so we're really grateful for this opportunity to speak with you about these things.
I'm so glad
because
that you're sharing
we
this.
can't solve it on our own. Anyway, we all have to work together to make the changes that are, and everybody will be better for it if we can
Absolutely. Absolutely. What would be some final words of wisdom or encouragement or cool things that you want to share with my audience before we close?
But this is kind of unrelated. It's a non sequitur, but I want to put this shout out because one of the things that I would like everyone to do is put in place a medical power of attorney. And we were talking to a woman about this, and it just resonated with me because she had her brother's medical power of attorney. And she said, doctors are looking to preserve life. Like they're, the Hippocratic Oath, whatever, they're looking to preserve life. But if you want someone making decisions when you can't speak for yourself about the quality of your life, don't you want that to be someone who knows you and someone who loves you? And if you don't have a medical power of attorney in place, then the doctor's going to have to make those decisions. And I thought, wow, that's really good advice. So even though it's a little bit unrelated to what we've been talking about today, I wanted to get that in there because I think it's something important.
Huh? Elaine, anything you want to add to that?
No, we just want to get the word out for people to listen, and to listen not just to our podcast, but to listen to the information about what's going on in healthcare, and figure out what you can do for yourself and for others to make it better.
Yeah, these are great words. Now, Brenda, where can people reach out and connect with you?
So we're at Body Wealth Sisters on Instagram, YouTube, where the podcast is on all the major podcast platforms. It's the Body Wealth Podcast. And where else, Elaine?
We're on Facebook too.
Oh, yeah, we're on Facebook
with
too.
Body Wealth Sisters. All of it is Body Wealth Sisters.
Perfect.
On all the past,
that's easy to find too, and people have different names for everything. It gets confusing, but you're everywhere, and we also have the links, and we will put the links in the show notes so you guys can reach out to Brenda and Elaine and connect with them for more questions, or just connect and follow and listen to their podcast. It's good to cross.
If you have a great story, we'd love, potentially to hear on the podcast as well. So
there you go. So thank you so much for coming on the show. And it's so great to meet you both. And I know Brenda and I will go for a coffee or a tea in the near future because she lives literally like 10 minutes from me. Unfortunately, Elaine is a little further, but maybe we meet in person as well. But I want to say thank you so much for coming on the show, and I really appreciate you.
Thank you. It's been great. Take care.
Thank you. So Igniter, it's your time to shine. Secure your 20-minute Spark Breakthrough call now, and let's pinpoint that one action step that will pivot your health journey. Don't wait. The link is waiting for you in the show notes. This is your moment to take a bold step towards the wellness you deserve. And thank you so much for Elaine Curry and Brenda Barbour for joining us today and sharing their invaluable insights on healthcare advocacy for Black and African American women. Remember, it's not just about listening, it's about taking action, whether questioning standard healthcare practices, seeking out more empathetic providers, or simply sharing your story with others. Every small step is the leap towards a more equitable health system. Let's not just end this conversation here. I encourage you, yes, you, to keep the conversation going. Share this episode and talk about it with friends, family, or even strangers. If this discussion inspires you or you have your own experience to share, please contact us at heike@heikeyates.com with the word advocacy in the subject line. Together, we're not just listeners, we are change makers. And that's it for today, my friend. And I'll see you next time on the Pursue Your Spark podcast. Ciao.